We'll introduce you. I've already given some of the generals on the webinar, so thank you those for all of you who have joined us today. We will get through this in about the next 30 minutes or so. Dr. Nate Stepp is, did I pronounce that right, Nate? Your last name, Stepp?
Yes, sir, you sure did.
Perfect. You're a Wisconsin native, went to school in Eau Claire, and now that's where you practice as well. You're out in our Lake Hallie area.
Yes, sir.
Spent a few years in the Navy as a physician. That's pretty cool. And thank you very much for your service. So,
pleasure.
We're very pleased to have you here today. You do a lot of these telehealth visits, so you're going to be working with Jeff as the patient, and we'll walk through that. For all of you that are participating, there is a chat feature and a Q&A feature there in the webinar. It's up in the upper right-hand corner. If you have a question for any of us during this presentation today, just click on that. You can ask your question, and we will do our best to make sure it's answered during the show today. If it comes in late and we don't get to it, we will address all those questions that come in later in the presentation as it gets sent back out. So, and again, as I mentioned earlier, this is recorded and it will be available on the Security Health Plan COVID-19 webpage within about 24 hours, probably a little bit less of the presentation actually happening. And those of you that did pre-register, it will be emailed directly to you at the email address you used. So without further ado, Nate, I'm going to skip right past Jeff because, you know, we just don't have time. Jeff is the co-host. Jeff Tucker is the Vice President of Business Development for the system. I'm Chris Bruning. I'm the VP of Sales for Security Health Plan. We are pleased to have Nate here, and I will pass it on to you guys. Thank you.
Hey, I will add one thing. I was reading through Dr. Stepp's bio prior to the webinar, and one of my favorite statements that you made in your bio is that you treat patients young and old, and you made the statement cradle to cane. And I've never heard that particular statement. I always hear it as cradle to grave, and I always think, oh, that's a little bit sad. I love the way that you stated that in your bio.
Yeah, it sounds very fatalistic if we say cradle to grave. So I felt we wanted to keep it a little bit more positive with the cradle to cane.
Yes, perfect.
And I thought of it. I came up with the tale of the Sphinx, the old statement of, you know, what walks on 4 legs in the morning, 2 legs in the afternoon, and 3 legs at night. And it's 4 legs when you're born because you're crawling, 2 legs as a young person, and into your older ages you're walking on 2 legs, and 3 legs at night when you got a cane, so your 3rd leg. So it sounded better that way.
Very cool.
So what can I do to help? So what can I start with?
Yep, I'm running the presentation, so as you want me to switch slides, you let me know. I'll go ahead and switch to the next slide.
Okay.
Or I won't, and it'll stay on this one.
So anybody who's watching the presentation, things to know is our cameras, when we set up for telehealth, as we are talking with this WebEx we are right now, my camera is located right here. The visual that I see of the person on the other end is just a little bit above. So if I look up a little bit and I'm not staring directly at you in the camera, it's because your picture is just above it. And that's very common with most people doing telehealth, is depending on where their camera is, if it's on the computer itself, if it's on a little camera here, it's going to be a little bit off. So that's something people have to get used to a little bit. But it's pretty understandable when you say, hey, my camera's here, but your picture's up here a little bit. So that sometimes he's not looking at me. I am. I'm just, the camera might be a little off center. So for telehealth, what we kind of look at is we're trying to interact with patients at home and be able to interact in a better option for people who can't come to the clinic because they're stuck at home, especially with elderly people who don't have rides or patients who don't have abilities to get to the clinic, those who are sick or are at high risk for illness, especially with the COVID-19 pandemic, or those who are unwilling or just kind of afraid, honestly, to come in. I use telehealth not only for those visits where they don't necessarily have to be in the office. So if you're saying, I'm working on my diabetes, I've already had my feet examined, I know where I'm at, I'm just doing a check-in. There's not a lot from a physical that I'm not going to get because I'll be honest, 90% of what I gather from patients is in the history it's kind of problem solving. It's talking to people, trying to get their numbers. If they have blood pressure cuffs at home, if they have blood sugar monitors at home, we gain a lot of information just with the face-to-face talking. I love face-to-face versus telephone because I can actually see you and you can see me, and that gives me a lot of indication. Hey, is there something else going on? Is there depression issues? Is there some struggles um, emotionally that you're just not able to catch over the phone sometimes? So I love the face-to-face that this provides. Um, and it gives us that open door into saying, you know what, you can still see us if you don't want to venture out. So I think that's a really huge benefit. Um, Number two is it's an option that's now covered with insurance plans. So that's helpful that if you need to get checked up, you don't feel like you're not being taken care of by your primary, because I'm still the one seeing people. Um, the last one is been doing telehealth before this coronavirus thing happened for patients who are way out there. So I have patients that I see for very medications. Some are in Rhinelander, some are way up in the middle of nowhere, between Park Falls and Minocqua, all the way down to La Crosse. I have some patients. I have two people that are in Madison even, who were here and now have moved, but they wanted to stick with seeing me, so I take care of them via telehealth from Madison. My longest one is a patient I usually see here who lives in the Rice Lake area, who's actually in Indiana but needed to get care, and one that was in Arizona that had a question about some bumps. So they called in, set up a telehealth. We did telehealth across the state lines, and that was fine because what they just had questions about some things and medications that they needed, we sent to the pharmacy here, and then they were forwarded off to them in their state of choice. If it was controlled, it had to go that way. If it's not controlled, they can fill prescriptions across the lines like Minnesota if you're stuck there for something. So it's a good option if you're traveling too. Let's see, what else? What's the next slide we got, Jeff?
I'm trying. I apologize, it's not moving.
Okay, so then how does a person set up for telehealth? So you would contact your health care provider's office just like you would otherwise. You just call and make an appointment, say, they'll actually ask you, um, do you want to be in person or do you want to be telehealth? Or we do have an option for telephone. It's not our first choice, frankly, but it does work for some things. Um, we're going to be having an online option too coming up here, so you'll be able to do it online sometime soon to set up appointments. So that'd be a good option for people too. So they can just go online, click, I want that time, and you'll be logged in. Once you've set the appointment, they gather a little bit of information, make sure that you're qualified for all that stuff, check your insurance, check your information, make sure they have a good phone number, and then they get an email. So they get your email address and they send you an email that shows, hi, you have been scheduled for an appointment with Nate Stepp at this time on this date. Um, 15 minutes prior to your appointment, my medical assistant will give you a call. And she calls and asks, hey, have you checked your weight recently? Or do you have a scale nearby you could check your weight? Do you have a blood pressure cuff at home? Have you been checking blood sugars for those who are diabetic? Do you have that stuff available? So you kind of gather up your resources for things you want to talk about at the appointment or things that you need available. She'll get a couple more questions from you just to see how things are holding up at home and with the surrounding life we have these days. And then we come and she says, okay, I've got all the things. If you want to click on the link, that'll put you into Dr. Stepp's waiting room, and I'll let him know you're ready. And when he's ready to get going, he'll hit the button and you'll be put in his personal room, and then we start the visit. And it sounds pretty simple. There are some snafus that occur along the process for some people because of the different tablet versus the iPhone versus a Samsung, Android phones, or Windows phones. or just Windows on the computer, and each of them have a little bit different setup, and we have a guide to help people walk through that as well, that our medical assistants have been doing amazing jobs with. Um, so yeah, there are some processes that we have to help people out as they're getting through it too for the first time. After the first time, it is much easier because you've done it before. But that first time has always been a little bit of a getting used to because you have to log into a new website. But again, the process does work pretty smoothly. Yep, and there's exactly what it looks like. That's an example of the email you would get. Again, appointment time, appointment date. You'd be seeing who it's with, and then you click that button. The hyperlink that says https:// Webex Nathaniel dot or step dot Nathaniel. And again, all those information we just said, and it works very well.
Okay, now here's the part where we're actually going to go into a visit. So I need to turn off my presentation for a moment, turn off my camera on one WebEx platform, and then I'm going to switch over to Dr. Stepp's platform. So bear with me for a moment. Like I said, this was last night.
And I'm going to be doing the same thing. So you'll see me close out of this one, and you'll see me pop up another one. Hopefully. All right, let me see if I can work that.
All right, while they're doing that, we'll just pause here, and it looks like the technology is working, so Jeff is coming back on. We actually want to show you the actual experience. So Jeff is going to pretend to be a patient here, and Nate doesn't have to pretend to be the doctor. He is the doctor. Nate, we're showing that you're muted, just so you know.
Can you hear me, Chris?
We can hear you, Jeff, yes.
Okay, thank you. All right, wish me luck.
All right.
All right.
All right.
Great, we can see you both.
Excellent.
There's going to be a little lag because I'm working through this service, and then I can hear it back through Jeff's computer. But that's only because we're doing this with the web-based versus what we normally be in person, just one-on-one. So if you hear kind of echoes or anything, that's why. I can hear myself in the headphones.
I don't know whether to mute myself on the web platform. It's working right now, so how about we leave it where it's at?
That's fine. No, that's no problem.
Okay.
So this is what you look like coming into a room. And I would say, well, hello, Jeff. I just want to check, make sure that I get your date of birth, just to qualify if I don't know you or I haven't seen you before. Just verify that.
January 1st, 1980.
Wow, so you're like the New Year's baby. That's awesome. All right, so what brings you in today? What can I do for you that you're logging in for?
I have high fever, shaking, chills, and I'm sweating.
Okay. And how long has that been going on for?
Oh, about 10 or 15 days.
I was going to say, if it was 10 or 15 minutes, that would be nerves, Jeff.
Yeah.
Since logging in.
So, has anybody else around you been sick?
No.
So fever, shaking, chills. Have you taken your temperature at all?
I have an elevated temperature and a headache.
Have you taken anything for it so far, like ibuprofen or Tylenol?
I took ibuprofen.
How much did you take?
Oh, I think 4 tablets.
The little over-the-counter ones are like the 200 milligrams.
Correct.
Have you been socially distancing yourself from other people recently?
I have been traveling. I've been gone. So it's occurred since I got back.
When you were traveling, were you in airports or large mass of people too?
I was traveling.
Anybody else live in the home with you right now, or that you've been in contact with in the last couple of days?
Yeah, I'm married. So
But they're not, that person not experiencing any symptoms right now?
no.
Have you had any other changes in terms of like bowel habits, diarrhea, constipation, troubles?
Yeah. Body aches. My skin seems a little different, a little bit
So-
yellow.
Can I interrupt just for our guests? I just wanted to ask a question here. So is this the screen that Jeff is seeing, Nate? This is exactly how a patient would see it, side by side like this?
So you can change it to either side by side, or take one person at a time.
Okay.
So up on your right hand corner, you can go to a little box that's next to floating panel view versus
Yep.
view and active speaker video view. And it would look different.
Yep, right now on my screen, I'm presenting, so you're probably all seeing Dr. Stepp
That's correct.
versus both of us.
In my screen, I can switch it over to be seeing both of us. I'm in a little tiny corner at the bottom. Or I can make it a view
Okay.
looking at both of us.
And just in the essence of time, let's assume that's all of Jeff's symptoms. We know that he's got a lot more than that, but let's just assume he's giving you all his symptoms.
Well, first of all, what you want to cure is you stay away from everybody. And I would recommend getting you set up to do a couple testing things, probably like COVID tests because of the situation we're in now. And then isolating yourself completely, wearing a mask in public, probably not going into public for at least until you got the results back from the initial test. Now, that being said, even the tests we have, even though they're amazing and wonderful, not perfect. So even if it's negative, I would say keep yourself socially distanced until you are about 24 to 48 hours after your symptoms resolve. And that's a good rule of thumb that we have right now. And then also we can do, if you have any missing work or anything, we would get a work note set up for you, and we can send it to you, or we can fax it to your employer if you would approve that. And then at the end of the visit, I say, okay, we got you set up for a testing done. I'll put the orders in, or I'll have my medical assistant do that. And then say, okay, if there's any other questions you got for me today.
Awesome.
And after that, I would say, okay, then I would, on my end, I can expel from the room. So it just means exiting. And then you go to detention, and then you get into suspension. I'm just kidding. But it's called expelling from our side, and then we move you out of the room, and we cancel the visit.
So how long does an average visit take, Nate?
It very much depends on the person. I've had them 10 minutes. I've had 35. It just depends on what type of issues a person is dealing with.
And when they are signing up and they get their appointment time and the patient logs in, are they with you pretty much immediately, or how long do they have to wait before you join?
For me, I don't like these. So it's usually within a couple minutes.
Okay.
But some people, I can't say that for every provider, because if they're running late in clinic, they will get there as soon as they're able. The downside with the Webbased is that if you're waiting for more than 15 minutes, it might kick you out. So then you just have to log back in the same way with email. that doesn't happen very often, but if you're way planning ahead and you have your appointment at 10 and you log in at 9:30 to be ready, it'll kick you out before I get there.
Okay. What's been your experience with patient feedback on these visits?
You know, a lot of people love it. It's been a huge impact on people who are distancing so they don't have to drive. People in the very older communities that just aren't available to get in or don't have a ride. And those who are high risk for infections. Again, our clinic is very safe, and I think most of our clinics and doctors' offices, including hospitals, are very safe from the coronavirus issues. But people are very scared, and this gives them a very easy option to access their provider and get answers and get questions and get medication they need without having to make that jump into the office. So most of it's been very positive.
Good.
This is available currently Monday through Friday, or is it available on weekends?
Right now, it's only Monday through Friday with us. They have Care My Way, but that's a different setup done with and not doing the video, but this is all done right now on Monday through Friday.
Okay.
Other pros or cons to this, Nate, that you've seen?
I like it because it gives that people that option. I miss the person-to-person interaction in the office, but that's just my personal opinion, I guess. But I get to see you, so that makes a big difference. I miss the little cues sometimes in body language because you can't see people moving. But I do really appreciate that it's an option and we can see people more than just on the phone.
Mm-hmm.
The hardest versions, honestly, is if somebody comes in and says, I'm having a really hard time breathing. Can't you hear me wheezing? No, I can't. I mean, can you put your microphone to your chest so I can hear you? So that's a tough time.
Yeah.
But generally speaking, it's been very well received. I think for most of the providers who are using it, they do like it.
Excellent. Ashley, did any questions come in? Otherwise, I think we've achieved the intent of the webinar. We walked you through what a virtual visit looks like and how to log in.
Yeah, Jeff, we haven't gotten any additional questions, just those couple we'd had ahead of time. So,
Okay.
I'm going to pop out of the Webex meeting with Jeff as a patient. Go back to the other meeting so you can see.
Okay.
Okay.
All right, we're back.
All right.
Yep.
So if there's any questions, I'm happy to answer from anything or anyone.
Nate, do you know if they're looking to expand the hours? I know Jeff asked the question about when it was available. Do you know if the clinic is looking at expanding the hours at all?
It's hard to say. Right now, what it would look like is if people who are in clinics on weekends, they would take it and do it. I haven't heard because we don't have a lot of patients wanting weekends that I can see right now because people even during work can do it during break time because they can log in from their phones.
Right.
I guess the biggest qualifier that we've noted is if you have a Wi-Fi or a high-speed internet of some kind, this works fantastic. If you are working on your phone data plans and you're not running off of Wi-Fi, it works fairly poorly because the speed of download is very fast. So you get a very blocky shots. It does work. It just takes a little bit more time and effort, but it still works. It just works best with Wi-Fi. So if you're having an appointment and you want to be completely incognito, go to Starbucks to your car and log in from your phone there. But it does have some, it's a little bit of slow issues there. So that's our only concern that I've noted. But weekends, I'd love to see it. I just don't know a lot of people who are willing to do more work on weekends when they're seeing full days of clinic right now. That could change if we had to do a major shutdown for hours or we get called into the hospital because of a pandemic explosion locally. Again, with our numbers through the last couple months, I don't see that happening. So I can't say it couldn't, but I don't see that happening. But that would be the one thing I think would push us to doing weekends too.
Okay. Any other questions, Jeff, from your area? Otherwise, we've covered the questions we've had from our guests today.
I think there was a question on what does telehealth cost? Did you ask that one, Chris? And
No, I did not.
part two of that is if the doc recommends I go in for an in-person visit, do I pay for both the telehealth and the in-person visit?
So most of the time, it's the same cost as an office visit. And it's covered the same, it's coded the same way in terms of problems and risk and all those things that we normally would use for a visit. If you're in a visit with them, a person or a patient, and you see that the problem that they're working with is too much for that office, for the telehealth, I personally would charge that visit and then just do the office visit when they come in and usually do that. There is oftentimes some people that'll charge an extremely small, like we call it level 1 for the telehealth, and then charge for the office visit as a normal office visit because it does take up time. And I mean, it takes up 10, even 15 minutes of everyone's time just to try to get it scheduled, get it set up, and get it moving. So most of the time, people just say, okay, this is too much for this kind of visit. We'll have to bring you into the office to do it. Or they'll take care of the problem on the spot with what they can and say, but let's schedule you for an office visit to follow up because we're going to start some treatment, but in order to really know if it's working, we'd have to see it physically to know if there's a change. So again, a lot of people do it a little bit of both ways. So I can't say 100%.
Sure, thank you. And that's all I have, Chris.
Okay. Well, thanks everybody for attending today. Nate, thank you very much for having Jeff as your patient. We know that's a tall task. So
it sounds like the diarrhea is really bad, so we got to find we got to make some calls.
We appreciate you walking through this visit with everybody. And again, this will be out there on our public website. So take a look at it later if you have other questions. If there's anything that you have questions on related to telehealth, certainly reach out to your own provider and ask them about it because it is available very widely now through Marshfield Clinic and other providers, I will say. So this is something that is a service that we look to continue to see expanding and being offered throughout the market. So once again, thanks, Nate. I think this was great. It was kind of fun to see the technology working, even though we could see the disconnect a little bit with the timing. But again, I think everybody's getting kind of used to some of those things. So we'll
just remember, I always say if anybody had to do this with AOL dial-up from about 1998, they would have no problem with the speed it's running at now. That's for sure.
Right. Yeah, those of us that can remember those days, yeah, we totally get what you're saying. So
if anybody hears that, they'll never go back.
Yeah, please, let's not do that again. All right, thanks, guys. This was a lot of fun, and we appreciate your time today, Dr. Nate. And again, if you want to schedule time with Dr. Nate, go to the Marshfield Clinic webpage, and you can schedule your own visit. We'd love to see you.
Thank you, guys.
All right,
much appreciated.
Thank you.
Thank you everyone who's watching too.
You bet. Have a great day, everybody. Be well.
Bye.